A postoperative patient has an epidural infusion of morphine sulfate, Astramorph. The patient's respiratory rate declines to 8 breaths per minute. Which medication would the nurse anticipate administering? A. Naloxone, Narcan, B. Acetylcysteine, Mucomyst, C. Methylprednisolone, Solumedrol, D. Protamine sulfate. Answer: A. Naloxone, Narcan. Rationale: naloxone is a narcotic antagonist that can reverse the effects, both adverse and therapeutic, of opioid narcotic analgesics. A nurse is caring for a cancer patient receiving subcutaneous morphine sulfate for pain. Which of the following nursing actions is most important in the care of this patient? A. Monitor urine output. B. Monitor respiratory rate. C. Monitor heart rate. D. Monitor temperature. Answer: B. Monitor respiratory rate. Rationale: morphine sulfate can suppress respiration and respiratory reflexes, such as cough. Patients should be monitored regularly for these effects to avoid respiratory compromise. Morphine sulfate does not significantly affect urine output, heart rate, or body temperature. A patient arrives at the emergency department complaining of back pain. He reports taking at least 3 acetaminophen tablets every 3 hours for the past week without relief. Which of the following symptoms suggests acetaminophen toxicity? A. Tinnitus. B. Diarrhea. C. Hypertension. D. Hepatic damage. Answer: D. Hepatic damage. Rationale: acetaminophen in even modestly large doses can cause serious liver damage that may result in death. Immediate evaluation of liver function is indicated with consideration of N-acetylcysteine administration as an antidote. Tinnitus is associated with aspirin overdose, not acetaminophen. Diarrhea and hypertension are not associated with acetaminophen. The nurse is planning care for a patient receiving morphine sulfate, Duramorph, by means of a patient-controlled analgesia, PCA, pump. Which intervention may be required because of a potential adverse effect of this drug? A. Administer cough suppressant. B. Insert Foley catheter. C. Administer antidiarrheal. D. Monitor liver function tests. Answer: B. Insert Foley catheter. Rationale: morphine can cause urinary hesitancy and urinary retention. If bladder distension or the inability to void is noted, the prescriber should be notified. Urinary catheterization may be required. Morphine acts as a cough suppressant and an antidiarrheal, so neither of those drugs would need to be administered to counteract an adverse effect of morphine. Liver toxicity is not a common adverse effect of morphine. 2 days after surgery, an elderly client refuses a PRN dose of analgesic dose for fear of becoming hooked. The nurse should respond by stating that A. It is impossible to become hooked on PRN narcotics. B. Short-term use of narcotics is not likely to cause a person to become dependent on them. C. Side effects that occur in the elderly mean that medications will be discontinued as soon as possible. D. The elderly are least likely to become dependent on narcotics. Answer: B. Short-term use of narcotics is not likely to cause a person to become dependent on them. A resident of a nursing home has quite severe arthritis. When administering an analgesic to this elderly resident, the nurse should A. Give the medication before the activity session in the day room. B. Give the medication when the resident states the pain is at 6 or higher on a 1 to 10 pain scale. C. Give the pain medication at mealtime. D. Make sure that the medication is not a narcotic. Answer. A. Give the medication before the activity session in the day room. An elderly client had abdominal surgery 6 hours earlier. When the nurse asks the client about pain, the client responds that there is none. The best intervention on the part of the nurse is A. Administer a PRN dose of IV pain medication as ordered. B. Assist the client into a sitting position in preparation for ambulation. C. Question the client further about discomfort to assess the meaning of pain. D. Assess the abdominal dressing and consult the surgeon about findings. Answer. C. Question the client further about discomfort to assess the meaning of pain. The safest narcotic choice for an elderly client with acute pain is A. Meperidine, Demerol. B. Oxycodone. C. Fentanyl transdermal patch. D. Morphine sulfate. Answer. D. Morphine sulfate. Rationale. Morphine is the gold standard of narcotics for acute pain. The other choices are incorrect. The nurse is creating a pain management plan for a client with a previous history of substance abuse. Which of the following should be included in this plan? A. Ask the physician to prescribe short-acting analgesics. B. Ask the physician to prescribe a medication similar to the one the client abused. C. Ask the physician to prescribe analgesics for the oral route. D. Keep a dose of Narcan at the bedside. Answer. C. Ask the physician to prescribe analgesics for the oral route. Rationale. Extended release and long-acting analgesics are recommended for clients with a history of abuse. Specific interventions should avoid analgesics similar to the abused drug. Utilize long-acting analgesics. Avoid Narcan. Administer medications through the oral route. A client in the ICU who sustained a traumatic abdominal injury 1 week ago continues to complain of severe pain. The nurse notes his vital signs are normal. Which of the following would be appropriate for the nurse to do? A. Encourage early return to ambulation. B. Offer non-narcotic analgesics for pain. C. Utilize distraction. D. Provide the client with pain medication. Answer. D. Provide the client with pain medication. The healthcare provider prescribes naproxen, twice daily for a client with osteoarthritis of the hands. The client tells the nurse that the drug does not seem to be effective after 3 weeks. Which is the best response for the nurse to provide? A. The frequency of the dosing is necessary to increase the effectiveness. B. Therapeutic blood levels of this drug are reached in 4 to 6 weeks. C. Another type of nonsteroidal anti-inflammatory drug may be indicated. D. Systemic corticosteroids are the next drugs of choice for pain relief. Answer. C. Another type of nonsteroidal anti-inflammatory drug may be indicated. Naloxone, Narcan, is administered to a client with severe respiratory depression and suspected drug overdose. After 20 minutes, the client remains unresponsive. The most likely explanation for this is A. The client did not use an opioid drug. B. The dose of naloxone was inadequate. C. The client is resistant to this drug. D. The drug overdose is irreversible. Answer: A. The client did not use an opioid drug. Rationale: if opioid antagonists, naloxone, fail to reverse symptoms of respiratory depression quickly, the overdose was likely due to a non-opioid substance. Nursing intervention for a client receiving opioid analgesics over an extended period of time should include A. Referring the client to a drug treatment center. B. Encouraging increased fluids and fiber in the diet. C. Monitoring for GI bleeding. D. Teaching the client to take her own blood pressure. Answer: B. Encouraging increased fluids and fiber in the diet. Rationale: opioids suppress intestinal contractility, increase anal sphincter tone, and inhibit fluids into the intestines, which can lead to constipation. There is nothing to indicate the drug is related to addiction problems. Opioids do not cause GI bleeding. The nurse administers morphine sulfate 4 mg IV to a client for treatment of severe pain. Which of the following assessments requires immediate nursing interventions? A. Blood pressure 110/70. B. The client is drowsy. C. Pain is unrelieved in 15 minutes. D. Respiratory rate 10 per minute. Answer: D. Respiratory rate 10 per minute. Rationale: opioids activate mu and kappa receptors that can cause profound respiratory depression. Respiratory rate should remain above 12. The BP is not significantly low. Drowsiness is an expected effect of morphine. Unrelieved pain warrants further assessment, but not as immediately as do decreased respirations. The client admitted with hepatitis B is prescribed Vicodin 2 tabs for treatment of pain. The appropriate nursing action is to A. Administer the drug as ordered. B. Administer 1 tablet only. C. Question the physician about the order. D. Hold the drug until the physician arrives. Answer: C. Question the physician about the order. Rationale: Vicodin is a combination drug of hydrocodone and acetaminophen. Acetaminophen can be hepatotoxic and is contraindicated in liver disease. A client who incurred an arm injury describes his pain as sharp and localized to the lower arm. The nurse recognizes that this type of pain would be relieved best by administration of which type of medication? Select all that apply. A. Muscle relaxant. B. Acetaminophen. C. Narcotic analgesics. D. NSAIDs. E. Antidepressant. Answer: C. Narcotic analgesics. D. NSAIDs. Rationale: injury to tissues produces nociceptor pain, which usually responds to conventional analgesic pain medications such as opiates or NSAIDs. The client informs the nurse that he has experienced pain in the lower extremities for the past 8 months. The nurse recognizes that this pain is classified as A. Moderate. B. Severe. C. acute D. Chronic. Answer. D. Chronic. Rationale. Chronic pain persists longer than 6 months. A nurse administers naloxone, Narcan, to a postoperative patient experiencing respiratory sedation. What undesirable effect would the nurse anticipate after giving this medication? A. Drowsiness. B. Tics and tremors. C. Increased pain. D. Nausea and vomiting. Answer. C. Increased pain. Rationale. Naloxone is a medication that reverses the effects of narcotics. Although the patient's respiratory status will improve after the administration of naloxone, pain will be more acute. The nurse is working on a postoperative unit where pain management is part of routine care. Which statement below is the most helpful in guiding clinical practice in this setting? A. At least 30% of the U.S. population is prone to drug addiction and abuse. B. The development of opioid dependence is rare when opioids are used for acute pain. C. Morphine is a common drug of abuse in the general population. D. The use of PRN, as needed, dosing provides the most consistent pain relief without risk of addiction. Answer. B. The development of opioid dependence is rare when opioids are used for acute pain. A patient takes oxycodone, OxyContin, 40 mg PO twice daily, for the management of chronic pain. Which intervention should be added to the plan of care to minimize the gastrointestinal adverse effects? A. Take an antacid with each dose. B. Eat foods high in lactobacilli. C. Take the medication on an empty stomach. D. Increase fluid and fiber in the diet. Answer. D. Increase fluid and fiber in the diet. Rationale. Narcotic analgesics reduce intestinal motility, leading to constipation. Increasing fluid and fiber in the diet can help manage this adverse effect. A patient admitted to the hospital with a diagnosis of pneumonia asks the nurse, "Why am I receiving codeine? I don't have any pain." The nurse's response is based on the knowledge that codeine also has which effect? A. Immunostimulant. B. Antitussive. C. Expectorant. D. Immunosuppressant. Answer. B. Antitussive. Rationale. Codeine provides both analgesic and antitussive therapeutic effects, as cough suppressant. Which agent below is most likely to cause serious respiratory depression as a potential adverse reaction? A. Morphine, Duramorph. B. Pentazocine, Talwin. C. Hydrocodone, Lortab. D. Nimefene, Revex. Answer. A. Morphine, Duramorph. Rationale. Morphine is a strong opioid agonist and as such has the highest likelihood of respiratory depression. Pentazocine, a partial agonist, and hydrocodone, a moderate to strong agonist, may cause respiratory depression but not as often and serious as morphine. Nimefene is an opioid antagonist and would be used to reverse respiratory depression with opioids. Which factor should the nurse consider while planning pharmacologic therapy for a patient with pain? 1. Narcotic analgesics should not be used for more than 24 hours. 2. Pain relief is best obtained by administering analgesics around the clock. 3. Analgesics should be administered as needed to minimize adverse effects. 4. Patients should request analgesics when the pain level reaches a 3 on a scale of 1 to 10. Answer. 2. Pain relief is best obtained by administering analgesics around the clock. Rationale. Studies have demonstrated that analgesics administered around the clock rather than on an as-needed basis provide the optimal pain relief. Narcotic analgesics have a potential for addiction. But pain management is more important, so they may be used for more than 24 hours. A rating of 3 on the pain scale may indicate effective pain relief. The nurse is caring for a patient who has oral ulcers. What type of pain, originating from the skin and mucous membranes, does the patient have? 1. Deep pain. 2. Visceral pain. 3. Somatic pain. 4. Superficial pain. Answer. 4. Superficial pain. Rationale. Pain is an unpleasant sensory and emotional experience that is associated with either actual or potential tissue damage. Superficial pain originates from the skin and mucous membranes. Deep pain originates in tissues below the skin level. Visceral pain originates from organs and smooth muscles. Somatic pain originates from skeletal muscles, ligaments, and joints. The nurse is assessing patients who are in severe pain. Which patient can safely receive morphine for pain relief? Patient A has spinal cancer. Patient B has renal impairment. Patient C has bradypnea. Patient D is under the influence of alcohol. Answer. Patient A has spinal cancer. Rationale. Patient A has spinal cancer with metastasis and is in severe pain. Morphine is used to treat moderate to severe pain. The patient has stable vital signs and can receive morphine for pain relief. Patient B has renal impairment, as evidenced by a high serum creatinine value, normal is 0.7 to 1.4, which might lead to the accumulation of the drug metabolite. The metabolite of morphine is toxic. If it is not excreted and instead accumulates, it might lead to toxicity or other complications. Patient C has bradypnea. Morphine, when given in high doses, causes respiratory depression, so patient C should not receive morphine. Patient D is under the influence of alcohol, and co-administration of morphine with alcohol can result in respiratory depression. A patient is being discharged after undergoing surgery with a prescription for fentanyl and a phenothiazine. What information is essential to include in the discharge teaching plan? 1. The phenothiazine will treat constipation. 2. The phenothiazine is taken to decrease nausea. 3. The phenothiazine will increase the effects of fentanyl. 4. The phenothiazine decreases the risk of respiratory depression from fentanyl. Answer. 2. The phenothiazine is taken to decrease nausea. Rationale. The patient is prescribed fentanyl for surgical pain management. Fentanyl is an opioid analgesic. Opioids decrease gastrointestinal tract peristalsis and also stimulate the vomiting center in the central nervous system, resulting in nausea. A phenothiazine helps to manage nausea. Phenothiazines do not affect the respiratory system or the digestive system. Therefore, it is not helpful for the management of respiratory depression or constipation. Phenothiazines have no synergistic effect with fentanyl. Therefore, phenothiazines do not improve the efficacy of fentanyl. which assessment finding indicates that the patient may have received an overdose of morphine sulfate. 1. Blood in urine. 2. Pinpoint pupils. 3. Heart rate 110 beats per minute. 4. Respiratory rate 28 breaths per minute. Answer. 2. Pinpoint pupils. Rationale. Morphine sulfate is an opioid drug used for pain management. After administration of morphine sulfate, the nurse should assess the patient's pupillary reaction to light. Pinpoint pupils indicate an overdose of morphine sulfate. Overdose of morphine sulfate does not cause blood in the urine, increased heart rate, or increased respiratory rate. What is the primary indication for the administration of morphine? 1. To treat ischemic pain. 2. To diminish feelings of anxiety. 3. To relieve acute and chronic pain. 4. To induce a state of unconsciousness. Answer. 3. To relieve acute and chronic pain. Rationale. The principal indication for morphine is the relief of moderate to severe acute and chronic pain, including postoperative pain and cancer pain. In addition, morphine is used during acute myocardial infarction to relieve pain, anxiety, and dyspnea, and to promote relaxation of vascular smooth muscle. Morphine may also be administered before surgery for sedation. Nitroglycerin is used to treat ischemic pain. A patient has taken an excessive dose of acetaminophen for pain management. Which adverse effects associated with acetaminophen are likely to be found in the patient? Select all that apply. 1. Nausea. 2. Vomiting. 3. Blurred vision. 4. Decreased hearing. 5. Elevated liver enzymes. Answer. 1. Nausea. 2. Vomiting. 5. Elevated liver enzymes. Rationale. Acetaminophen is a nonsteroidal anti-inflammatory drug. Nausea, vomiting, and elevated liver enzymes are the effects of an excess dose of acetaminophen. Acetaminophen does not affect vision or hearing function. A patient needs to switch analgesic drugs after an adverse reaction to the present regimen. The patient is concerned about not receiving an effective dose of the new drug to control pain. The nurse responds based on knowledge that potencies of analgesics are determined using an equianalgesic table comparing doses of these drugs with what prototype? 1. Codeine. 2. Fentanyl. 3. Morphine. 4. Meperidine. Answer. 3. Morphine. Rationale. Equianalgesia refers to the ability to provide equivalent pain relief by calculating dosages of different drugs and/or routes of administration that provide comparable analgesia. If the opioid used is not morphine, the nurse will convert its dose to the equianalgesic dose of morphine. In monitoring a patient for adverse effects to morphine sulfate, MS content, the nurse assesses for stimulation of which area in the central nervous system, CNS. 1. Stimulation of circulation. 2. Stimulation of respiratory rate. 3. Stimulation of the cough reflex. 4. Stimulation of the chemoreceptor trigger zone. Answer. 4. Stimulation of the chemoreceptor trigger zone. Rationale. Morphine sulfate can irritate the gastrointestinal tract, causing stimulation of the chemoreceptor trigger zone in the brain, which in turn causes nausea and vomiting. Opioids cause a decrease in respiratory rate, not stimulation. Which finding alerts the nurse to the possibility that the patient is experiencing adverse effects of morphine sulfate? 1. Diarrhea. 2. Insomnia. 3. Drowsiness. 4. Hyperactive bowel sounds. Answer. 3. Drowsiness. Rationale. Morphine sulfate depresses the central nervous system, resulting in drowsiness. It also causes a decrease in gastrointestinal motility, leading to constipation. This effect is helpful in treating diarrhea. Morphine sulfate does not cause insomnia. Morphine does not cause hyperactive bowel sounds. Which condition listed in the patient's medical history could be a contraindication to administration of morphine sulfate? 1. Cancer. 2. Asthma. 3. Diarrhea. 4. Anorexia. Answer. 2. Asthma. Rationale. Morphine sulfate should be used with caution in patients with asthma, because naturally occurring opioids cause the release of histamine. A release of histamine in a patient with asthma can trigger bronchoconstriction. Because 20% to 35% of morphine sulfate binds to protein, cancer and anorexia are causes for concern. Because both conditions can result in hypoproteinemia and a lack of protein binding sites for morphine, which can alter the pharmacokinetics of the medication. The administration of morphine sulfate can help diminish diarrhea. Which condition would contraindicate the administration of naltrexone hydrochloride? 1. Anemia. 2. Asthma. 3. Diabetes. 4. Hepatitis. Answer. 4. Hepatitis. Rationale. Administration of naltrexone hydrochloride is contraindicated in a patient who has hepatitis or liver dysfunction. Administering naltrexone hydrochloride to these patients may produce severe complications, because the drug is metabolized in the liver. Naltrexone hydrochloride does not alter hemoglobin levels, respiratory function, or blood sugar levels. Thus, the administration of naltrexone hydrochloride is safe in a patient who has anemia, asthma, or diabetes. A patient is prescribed oxycodone extended release, ER, for pain management. What information is essential to include in the teaching plan? Select all that apply. 1. Do not crush the medication. 2. Swallow the medication whole. 3. Take the medication frequently. 4. Do not dissolve the medication in water. 5. Increase the dose if you experience no pain relief. Answer. 1. Do not crush the medication. 2. Swallow the medication whole. 4. Do not dissolve the medication in water. Rationale. Oxycodone ER is an extended-release dosage form. The nurse should instruct the patient not to chew or crush the medicine to prevent excessive sedation, urinary retention, and respiratory depression. The medication should be swallowed whole. Chewing or crushing or dissolving the medication in water would result in increased serum concentration of the drug, which may cause adverse effects. Rapid absorption of the drug results in severe opioid toxicity. The medication is not taken frequently because it is an extended release form. This means it works for longer periods of time. The patient should not increase the dose if there is no pain relief, but rather should call the primary healthcare provider. A patient who regularly takes acetaminophen returns to the clinic for a follow-up visit. Which assessment indicates the need for a change in the patient's therapy? 1. Hemoglobin 11.2 grams per deciliter. 2. Serum bilirubin 3.2 mg per deciliter 3. Serum creatinine 0.8 mg per deciliter 4. Random blood glucose 160 mg per deciliter. Answer. 2. Serum bilirubin 3.2 mg per deciliter. Rationale. Acetaminophen used for pain relief can be hepatotoxic if taken in large doses. Elevated serum bilirubin indicates chemical damage to the liver. A serum bilirubin level of 3.2 mg per deciliter is much higher than normal. It indicates hepatotoxicity and the need for a change in therapy. A hemoglobin level of 11.2 grams per deciliter. Serum creatinine level of 0.8 mg per deciliter. And random blood glucose level of 160 mg per deciliter are under the normal range. The nurse is caring for a patient with opioid addiction. The nurse anticipates that the patient will be prescribed which medication? A. Naloxone, Narcan, B. Meperidine, Demerol, C. Morphine, MS Contin, D. Methadone, Dolophine. Answer. D. Methadone, Dolophine. A patient with renal cancer needs an opiate for pain control. Which opioid medication would be the safest choice for this patient? A. Fentanyl, B. Hydromorphone, Dilaudid, C. Morphine sulfate, D. Methadone, Dolophine. Answer. D. Methadone, Dolophine. An opioid analgesic is prescribed for a patient. The nurse checks the patient's medical history knowing this medication is contraindicated in which disorder? A. Renal insufficiency, B. Severe asthma, C. Sleep apnea, D. Severe head injury, E. Liver disease. Answer. B. Severe asthma, C. Sleep apnea, D. Severe head injury. Intravenous morphine is prescribed for a patient who has had surgery. The nurse informs the patient that which common adverse effects can occur with this medication. Select all that apply. A. Diarrhea, B. Constipation, C. Pruritus, D. Urinary frequency, E. Nausea. Answer. B. Constipation, C. Pruritus, E. Nausea. A patient with bone pain caused by metastatic cancer will be receiving transdermal fentanyl patches. The patient asks the nurse what benefits these patches have. The nurse's best response includes which of these features? A. More constant drug levels for analgesia, B. Less constipation and minimal dry mouth, C. Less drowsiness than with oral opioids, D. Lower dependency potential and no major adverse effects. Answer. A. More constant drug levels for analgesia. When assessing a patient for adverse effects related to morphine sulfate, MS Contin, which clinical findings are the nurse most likely to find? A. Diarrhea, B. Weight gain, C. Constipation, D. Inability to void, E. Excessive bruising. Answer. C. Constipation, D. Inability to void. In developing a plan of care for a patient receiving morphine sulfate, MS Contin, which nursing diagnosis has the highest priority? A. Acute pain related to metastatic tumor cancer, B. Impaired gas exchange related to respiratory depression. C. Constipation related to decreased GI motility. D. Risk for injury related to CNS adverse effects. Answer: B. Impaired gas exchange related to respiratory depression. The nurse teaches a patient prescribed the fentanyl, Duragesic, transdermal delivery system to change the patch at what interval? A. Once a week. B. Every 24 hours. C. Every 72 hours. D. When pain recurs. Answer: C. Every 72 hours. A patient prescribed massage therapy for musculoskeletal pain asks the nurse, "How is rubbing my muscles going to make the pain go away?" What is the nurse's best response? A. Massaging muscles helps relax the contracted fibers and decrease painful stimuli. Incorrect. B. Massaging muscles decreases the inflammatory response that initiates the painful stimuli. C. Massaging muscles activates large sensory nerve fibers that send signals to the spinal cord to close the gate, thus blocking painful stimuli from reaching the brain. D. Massaging muscles activates small sensory nerve fibers that send signals to the spinal cord to open the gate and allow endorphins to reach the muscles and relieve the pain. Answer: C. Massaging muscles activates large sensory nerve fibers that send signals to the spinal cord to close the gate, thus blocking painful stimuli from reaching the brain. Vicodin, acetaminophen, hydrocodone, is prescribed for a patient who has had surgery. The nurse informs the patient that which common adverse effects can occur with this medication. Select all that apply. A. Diarrhea. B. Constipation. C. Lightheadedness. D. Nervousness. E. Urinary retention. F. Itching. Answer: B. Constipation. C. Lightheadedness. E. Urinary retention. F. Itching. A patient is suffering from tendinitis of the knee. The nurse is reviewing the patient's medication administration record and recognizes that which adjuvant medication is most appropriate for this type of pain. A. Antidepressant. B. Anticonvulsant. C. Corticosteroid. D. Local anesthesia. Answer: C. Corticosteroid. A patient arrives at the urgent care center complaining of leg pain after a fall when rock climbing. The X-rays show no broken bones, but he has a large bruise on his thigh. The patient says he drives a truck and does not want to take anything strong because he needs to stay awake. Which statement by the nurse is most appropriate? A. It would be best for you not to take anything if you are planning to drive your truck. B. We will discuss with your doctor about taking an opioid because that would work best for your pain. C. You can take acetaminophen, also known as Tylenol, for pain, but no more than 1,000 milligrams per day. D. You can take acetaminophen, also known as Tylenol, for pain, but no more than 3,000 milligrams per day. Answer: D. You can take acetaminophen, also known as Tylenol, for pain, but no more than 3,000 milligrams per day. The drug nalbuphine, Nubane, is an agonist-antagonist, partial agonist. The nurse understands that which is a characteristic of partial agonists. A. They have anti-inflammatory effects. B. They are given to reverse the effects of opiates. C. They have a higher potency than agonists. D. They have a lower dependency potential than agonists. Answer. D. They have a lower dependency potential than agonists. A patient is receiving gabapentin, Neurontin, an anticonvulsant, but has no history of seizures. The nurse expects that the patient is receiving this drug for which condition? A. Inflammation, pain. B. Pain associated with peripheral neuropathy. C. Depression associated with chronic pain. D. Prevention of seizures. Answer. B. Pain associated with peripheral neuropathy. A patient is to receive acetylcysteine, mucomyst, as part of the treatment for an acetaminophen, Tylenol, overdose. Which action by the nurse is appropriate when giving this medication? A. Giving the medication undiluted for full effect. B. Avoiding the use of a straw when giving this medication. C. Disguising the flavor with soda or flavored water. D. Preparing to give this medication via a nebulizer. Answer. C. Disguising the flavor with soda or flavored water. The nurse is reviewing herbal therapies. Which is a common use of the herb feverfew? A. Muscle aches. B. Migraine headaches. C. Leg cramps. D. Incision pain after surgery. Answer. B. Migraine headaches. A patient has been treated for lung cancer for 3 years. Over the past few months, the patient has noticed that the opioid analgesic is not helping as much as it had previously, and more medication is needed for the same pain relief. The nurse is aware that this patient is experiencing which of these? A. Opioid addiction. B. Opioid tolerance. C. Opioid toxicity. D. Opioid abstinence syndrome. Answer. B. Opioid tolerance. A patient will be discharged with a 1-week supply of an opioid analgesic for pain management after abdominal surgery. The nurse will include which information in the teaching plan? A. How to prevent dehydration due to diarrhea. B. The importance of taking the drug only when the pain becomes severe. C. How to prevent constipation. D. The importance of taking the drug on an empty stomach. Answer. C. How to prevent constipation. An 18-year-old basketball player fell and twisted his ankle during a game. The nurse will A. Synthetic opioid, such as meperidine, Demerol. B. Opium alkaloid, such as morphine sulfate. C. Opioid antagonist, such as naloxone HCl, Narcan. D. Non-opioid analgesic, such as indomethacin. Answer. D. Non-opioid analgesic, such as indomethacin.